So, that is a spreader slide, and there is a slide on which you are preparing the PBS. This is the spreader slide, and this is the slide on which you are preparing the PBS. So, you put a drop of blood here and then put the spreader on the drop of blood, and then the drop of blood gets like this, and we have to draw the smear at, this will be a 45-degree angle, and you have to draw the smear in this way, and this is what you get as the end product. So, what an ideal PBS smear looks like. This part is very thick, you can't identify the cells. This is the middle part and this is the tail end. What we see is in the tail end. This tail end is very important, and the smear of the peripheral blood looks like it is a tongue shaped smear, and you put the drop not in the end of the slide but a little towards the middle of the slide, and this smear covers almost 2/3 of the slide. This is an ideal peripheral smear. This is the tail end, and we all get the findings in the tail end of the smear. Here you won't get any findings because this is very thick, and in the tail end of the smear where the RBCs lie just touching each other. The RBCs will be just touching each other in the tail end. There we study the peripheral blood film. We stain it by Leishman stain, and today we shall talk about microcytic hypochromic RBCs. What we see in the peripheral in case of a microcytic hypochromic anemia. So, what is chromia? Color. So, hypochromia means less color. From where does the RBC get the color? What is the source of the color in RBC? Hemoglobin. Hypochromia means less color, means less hemoglobin. And what do you mean by cytosis? Size of the cell. The size of the cell, micro means small. Means the size of the RBCs also becomes small. So, you are getting a microcytic hypochromic blood picture. So, here you can see normally the RBC is a biconcave disc and the middle 1/3 is pale and the hemoglobin is in the outer 2/3. Here you can, the pallor will not exceed, the central pallor will not exceed 1/3 of the size of the RBC. It will remain within 1/3 of the size of the RBC. So, if this is the size of the RBC, then you can see that the pallor is more than the size of, more than 1/3 of the size of the RBC. You see there is a thin rim of hemoglobin and the middle portion is colorless. That means the mid portion does not contain any hemoglobin, only there is a peripheral rim of hemoglobin. So, these kind of RBCs, these are typically found in microcytic hypochromic anemia. Okay. Just see these cells. There is a thin rim of hemoglobin outside and there is so much pallor inside. Okay. So, this is going to be a spotter in your exam. A similar kind of slide will be given to you and you have to identify the slide. Like you have to say it is hypochromic microcytic RBCs, you have to identify. So, this is a zoomed picture. This is also microcytic hypochromic RBCs. Now, first of all, you have to know what is the normal size of the RBC. What is the normal size of the RBC? 80 to 100. Okay. Below 80 is microcytic, above 100 is macrocytic. So, these are zoomed pictures, don't take it as large RBCs. You see there is the rim of hemoglobin and the central pallor is so much. And this is what is called basophilic stippling of RBC. So, one by one I am coming to the features. See, this granule like things, these are called stipplings, basophilic stipplings. These are basophilic in color and this can be seen in thalassemia trait and there are many other diseases like lead poisoning. You will get basophilic stippling of RBCs. So, if you see this thing, it can be a beta thalassemia trait or it can be a case of lead poisoning or any heavy metal poisoning. This is another picture of microcytic hypochromic anemia. Here you have to learn 2 points. One is anisocytosis. What is anisocytosis? What is anisocytosis? Do you know? There is difference in the size of the cells and poikilocytosis, difference in the shape of the cell. Shape of the cells is poikilocytosis and size of the cell is anisocytosis. You have to remember it very well because you have to write it or you will be asked about this. And in iron deficiency anemia, we see hypochromia, microcytosis, anisocytosis, poikilocytosis. We see everything. So, these are the microcytic hypochromic cells and see all the cells are not uniform in size. The cells, this cell is like oval and a slight larger compared to this cell. This cell is very small. So, there is a variation in the cell size. This cell is small, this cell is bigger, this is a nucleated RBC. These cells are smaller, this is a smaller cell and the shape of the cell, you can see the shape of the cell is not round. This is somewhat like pencil like shape. So, this shape is not the usual shape of the RBC, we call it poikilocytosis. Okay, when you get variation in the shape. This is like a teardrop. This is like a teardrop. This is a teardrop cell. So, when you get this kind of When we get this kind of cells, these are called poikilocytosis, and when you get this much of variation in the size of the cells, you call it anisocytosis. Any query? What is Google saying? What is Google saying? Anything extra? First of all, get an idea of what you have to prepare for the exams. Then go to your hostel or home and then Google it. There is everything in Google, but there is that everything is not going to come in the exams. Okay, first of all, get an idea what you have to do in the exams, what you will be given in your exams. Get an idea and then go and Google at home. So, there is difference in the color. These are spherocytes. Okay, microspherocytes. And there is also difference in the size. This cell is bigger than these cells. These are microspherocytes, and these cells are bigger cells. So, there is anisocytosis along with these microspherocytes. All these slides can come in your exam as a spotter and you have to write it. You have to describe the smear, no one is asking for the diagnosis. Even if you can't diagnose, there will be no problem, but you have to describe it properly. I know it's hereditary spherocytosis, everyone knows, but you have to describe the smear properly. So, this is a Leishman stain peripheral blood smear. You have to tell that Leishman stain peripheral blood smear showing RBCs which vary in size and shape. There are small RBCs as well as RBCs which have deformed shape, and RBCs are mostly microcytic hypochromic, and a few NRBCs are also seen. This is an NRBC. This is the nucleated. How will you know it is NRBC? The cytoplasm is of the same color as the cytoplasm of RBC. This is almost of a size of a lymphocyte, small mature lymphocyte. But in lymphocyte you will get a bluish rim of cytoplasm. Here the color of the cytoplasm will be same as the color of the cytoplasm of RBC. So, there is mild anisocytosis as well as mild poikilocytosis. These cells, these oval cells, this cell. So, there is anisocytosis as well as mild poikilocytosis, and the RBCs are mostly microcytic hypochromic, few microovalocytes are also seen. And polychromasia. This cell is larger, you see, and the color of the cells are not uniform. That's why it's called polychromasia. The cells are of different colors, and these cells are bigger than these cells. So, there is polychromasia and there is spherocytosis. Okay. Neutrophilia has been taught, no? Okay, now tell me, someone volunteer, tell me what are the causes of neutrophilia? Physiological causes and pathological causes. Questions will be asked like this. Someone volunteer and tell me. Acute infection, then bacterial infection, viral infection, there won't be neutrophilia. Then this is pathological cause. What are the physiological causes of neutrophilia? Pregnancy. First, pregnancy. Second, anemia. Anemia. In anemia, you will get neutrophilia. And the pathological causes, you have all the pathological causes. Bacterial infection, acute myocardial infection, any kind of infection except viral, you will get increased neutrophil count. Then comes acute myocardial infarction. There will be rise in neutrophil count or neutrophil percentage. And then leukemia, chronic leukemia. Okay, these have been taught. And what are the causes of decreased neutrophil count? Neutropenia. What are the causes of neutropenia? No, there will be neutrophilia. In acute hemorrhage, there will be neutrophilia. Viral infection. Good. Then aplastic anemia. Aplastic anemia following chemotherapy, following radiation therapy, there will be decrease in neutrophil count. So, if a slide is given with neutrophilia, you will be able to identify the neutrophils. How many lobes does a neutrophil have? 3 to 5. If it is more than 5, what may be the cause? Hypersegmented neutrophil. What may be the cause? Don't tell the rare causes first. First tell the common cause. Which kind of anemia? Megaloblastic anemia. Megaloblastic anemia. That is the most common cause of hypersegmented neutrophil. And what is a band cell? Stem cell. Then comes the stem cells have been allocated and the neutrophil series. What is the first cell in the neutrophil series? First cell is the blast. Not normoblast. Normoblast is RBC. Blast cell, blast. Simple blast cell, neutrophilic blast. Then second is promyelocyte. Then myelocyte. Then metamyelocyte, then bands, and then mature neutrophil. You have to remember this lineage, and you have to what is the biggest cell in this lineage? Large in size. Which one is the biggest cell? No, blast is small. It has a big nucleus and a small rim of cytoplasm. No, promyelocyte. And there the azurophilic granules, the primitive granules appear in the promyelocytes. How do you discriminate between a cell, a neutrophil full of toxic granules and a basophil? How do you discriminate? Morphologically. A basophil and a neutrophil full of toxic granules. Tell me. How does a basophil look like? These all things have been taught in physiology, na? Basophil pink, deep purple, and how many lobes does a basophil have in its nucleus? How many lobes? Basophils? 2. So in basophil, in this case you have to study the nucleus of the cell. If it is a bilobed cell like headphone like nucleus and full of granules which are overlapping the nucleus, it is a basophil. And neutrophil with toxic granules, you can see the nucleus of the neutrophil. It will have 3 to 5 lobes. So by looking at the nucleus, you can discriminate. Now, where this discrimination is necessary? In case of CML, you will get 8 to 10% of basophils. And similarly there will be neutrophils. If there is superadded infection, the neutrophils might have toxic granules also. So you have to discriminate, you have to give a proper basophil count for the treatment of the patient or for determining the stage of the patient. Okay, how do the eosinophils look like? Bilobed, kidney shaped, and granules? Orange granules. So you have to learn the RBC indices. How you calculate the RBC indices? You have to take in account hemoglobin, PCV and total RBC count, and you have to find out the MCV, MCH, MCHC. These are the RBC indices. You have to find out the RBC indices, and then you can say what is microcytic hypochromic, not hypochromic, what is microcytic RBC, what is normal RBC, and what is macrocytic RBC. You have to know their normal values. These are all asked in the examination. And then coming to chromatia, you have to know that the RBC has central 1/3 pallor and the rest hemoglobin. So if the pallor of the RBC is more than 1/3, then it is hypochromic. There is nothing called hyperchromic, and there are microspherocytes where there is no central pallor. These things you have to remember, and you have to know the causes of microcytic hypochromic anemia, all the causes, and you have to know about anisocytosis. You have to know about poikilocytosis, the various types of cells, various shapes of cells you get in anemia. Like target cell, then bar cells, then pencil cells. All these come under poikilocytosis. So you have to know the reasons of poikilocytosis and in which condition what is found. Basophilic stippling, like it is found in lead poisoning, it is found in thalassemia. So you go home, open your Google. You don't read books, I know. Open your Google and find out and make a note of all these things, because this will be asked in the exam, and when it will be asked in the exam, many of you will be like, what is this, what are they asking, I have never read such a thing. So today only you go and read the whole thing and make a note of everything. This PowerPoint is just for showing you what are the things, the outline of the things, and these things you have to study. You have to study it thoroughly, and in questions, these questions will be asked in your exam, and the slides will come as spotted. Okay. Today I could not get any slide of microcytic hypochromic anemia. There was no case actually in the central lab.